Hi everyone, this is your tutor from Nursing Prep class. So in this video, we are going to look at the tip for NCLEX, and I'll be coming up with more such tips weekly, and this is the tip for this week. So the tip for this week is consider the age. So I'm going to show you that how important it is to look at the age while we are solving the questions and how that totally changes the scenario. So if we look at this condition called hydrocephalus, where the CSF or cerebrospinal fluid increases, so the volume or the amount of cerebrospinal fluid increases, leading to increased intracranial pressure or increase in ICP. Due to that, the person will experience signs and symptoms like irritability, emesis, headache, and mood swings. So they all make sense. So they all are 100% true for the diagnosis like hydrocephalus. So if we had to choose these options for someone who is an adolescent or maybe an adult, the question states, if it is select all that apply question, we can choose irritability, emesis, headache, and mood swings, all of those. So that makes sense for this diagnosis. So all are right. But now watch how the thing changes. So had this question been saying that out of these, you have to choose the signs and symptoms which are relevant for a child who is an infant. Now, this infant means the child who is less than 1 year of age. And now this is a SATA question, select all that apply. In this, we have to choose all that are relevant. So let us see the options. Irritability. Though irritability, emesis, headache, and mood swings all make sense for hydrocephalus, and in any given age except that of an infant, it might have made sense. Of course, it does make sense for adults and some older children. Then, if we look for infant, can we choose irritability? I know infants do show irritability, but in APGAR scoring, the irritable facial expressions that they have is something which is true for them, and this is totally normal and that is okay. So that doesn't signify to us that this is some case of underlying disease condition. So irritability just doesn't make sense for an infant because we cannot tell why is an infant irritable, whether he's hungry, whether he's having hydrocephalus, or if he's having something else and other concern. Now let us take a look at emesis. Can we see emesis? Yes, we can see, but the child cannot tell us that he's feeling nauseous, right? So emesis is okay. Let us take a look at another option, which is headache. Is a child less than a year of age going to tell us that he's having headache? No, of course he's not. So this option, even though if it makes sense for hydrocephalus, it doesn't make sense for an infant. Mood swings. So we cannot see the mood swings in a baby. Therefore, this option is gone too. So in spite of all these options being correct, only emesis stands right. So see how wonderfully the age played a role in changing the answers, and I hope it helps.